again. So my name is Dr. Vidur Mahajan. I run a company called Mahajan Imaging. It's a diagnostics company. I also am a researcher. I lead research and development at CARING, which is the Center for Advanced Research in Imaging, Neurosciences and Genomics. And I'm also privileged to be a founding director of MeraDoc. I will be your host for the next hour or so. With us we have luminaries of the field who have kindly consented their time to come and share some of their experiences, some of their thoughts, some of their wisdom on life after COVID, how they see it both from a clinical and generally also philosophical perspective. We have with us Dr. Randhir Sud. Dr. Sud is the chairman of Gastroenterology and Digestive and Hepatobiliary Disease at Medanta. And he will be talking to us about generally what is post-COVID syndrome and how does it, what is long COVID? We've all heard about it. It would be great to get his perspective. Then we would go to Dr. Anoop Misra, and another very, very well-known figure in the medical field today. Dr. Misra serves as the chairman for the Fortis Centre for Diabetes, Obesity and Cholesterol, better known as Fortis CDOC, and also the head of the National Diabetes and Cholesterol Foundation. Dr. Mishra would tell us about the implications of the whole post-COVID scenario on metabolic diseases, especially diabetes, and then also maybe touch upon super infections and other newer concepts that we are all having to learn related to COVID. Last and absolutely not the least, we have Dr. Rahul Gupta, another very well-known physician in Delhi and around Delhi. He's a senior consultant physician gastroenterologist at Holy Family Hospital and at PSRI Hospital, both of which are in South Delhi. And Dr. Gupta would tell us about how COVID has maybe impacted us from a mental and a social viewpoint, and how one can deal with that. So without further ado, I'd just like to say that, in case you'd like, please feel free to ask questions. The idea is to make this as interactive as possible. We will try to take your questions on the fly if they are relevant in that sense. And feel free to use the chat box, feel free to use the Q&A tab ask us whatever questions you may have. I am just, Dr. Randhir Sood was to start off, but I've noticed that he's had to jump off the call. So maybe, in the interest of time, Dr. Anoop Misra, could we have your opening comments, in terms of what is long COVID, what is post-COVID syndrome, and then more specifically, how does it affect metabolic disease? Dr. Misra, please. So you're on mute.
Thank you, Vidur, for that very nice introduction. I am indeed grateful to you, MeraDoc, and everybody involved in the organization of this very fine symposium. It's unfortunate that Dr. Randhir Sood is not able to present the first.
Actually, sir, he has just joined back. So if you don't mind, Dr. Sood, are you ready?
Yeah.
Is everything fine?
Oh, if he's ready, then that my job will be easier. That's fine.
So great. So sorry, everyone. So we'll switch back to the original program, which was starting off with Dr. Sood. So Dr. Sood, if you could start and educate us on what is long COVID, what is this enigma of the post-COVID syndrome. The floor is yours.
Thank you, Vidur. Sorry for the delay. The problem was more technical because I was unable to join with my with my laptop.
No problem, sir. No problem.
So now it is all set. So I think it should. I'm just going to share my slides. Well, we all, who have suffered or who had somebody who suffered from COVID, wonder what this entity is. and we have we are all very curious to know what exactly long COVID is. So I'll just like to share my slide, and I think you can see it. Can you see my slides?
Yeah, we can see.
Okay. So the main thing is that we have to understand that the COVID itself has varied presentation. Some patients present with minimal symptoms. Some patients have moderate symptoms, require hospitalization, and some patients have very severe disease requiring ICU admission. Then various symptoms of whether there's typical viral illness or just loss of smell and taste. So there is a varied presentation of COVID. Then many patients who become virus negative or seem to have recovered from the acute illness continue to have health issues, and these keep on bothering them. And to describe this continued illness, with the various terms are used, and one is prolonged COVID, the other is post-COVID syndrome, and this has been objectivized by National Institute of Healthcare and Excellence. That's a nice, and they have classified COVID into various situations. Acute COVID illness is the illness which lasts for less than 4 weeks. And it happens when you get infection of COVID, and then you are having some residual symptoms up to 4 weeks will come under acute illness. If a person continues to have some symptoms and beyond 4 weeks, till about 3 months, this is ongoing symptoms of COVID-19. And if you are still having issues with your health after recovery from COVID beyond 3 months, then it is known as post-COVID syndrome. And when you combine both ongoing symptoms and of post-COVID syndrome, this is known as long COVID. So it is very clearly defined now that anything which is lasting for more than 4 weeks, which is ongoing symptomatic COVID, or which is happening beyond 3 months, it still comes under long COVID. And these patients tend to have various manifestations, which I'll answer shortly. So when we are talking of long COVID, questions are, why does it happen? And how frequent it is? And are there any predisposing factors which can make a person more prone to it? Or and what are the common symptoms which should warn us that it is a post-COVID syndrome and not some new ailment or anything? And then, and in the end of it, what is the management of prolonged COVID? Now, like most of the things about COVID, it's a new entity, and we are still, getting more and more insight into it, and we don't know all the answers yet. So, why does it happen? Is the first thing. Is it because of the virus itself, that there is a direct viral effect on the various organs of the body? Is it because this virus, as in COVID itself, precipitates acute, immune reaction and cytokine storm, and which leads to various effects? And most important, which people are worried and which can lead to serious consequences, are endothelialitis. What is endothelialitis? This is inflammation of the lining of the blood vessels. And this causes micro or macro thrombi, that the blood clotting happens. Now, this is a normal phenomena of immunity which tries to contain an infection to a limited area. So this is normally what body does to limit the infection to a particular area. It causes inflammation of the blood vessels and microthrombi so that infection doesn't spread. But when it happens in body, other organs which are not supposed to have it, it leads to serious consequences. Then there is inflammation of the lining of the various body organs, like heart, like lung, like abdominal cavity, and this is what is serositis. And then there is certain effects which are due to the therapeutic interventions, like steroids, like various immunosuppressants, tocilizumab, etc. And we don't know other medication which may have certain effects which may lead to these symptoms. So these are possible causes why long COVID happens. The symptoms can be very vague, like fatigue, that you just don't feel up to the mark and you have shortness of breath or difficulty in breathing. Mild cough which persists, and dry cough persistence is very common. Joint pains, chest pain, and brain fogging, that's memory and concentration or sleep problems. Sleep problems are very common in elderly. muscle pain or headaches, fast or pounding heartbeat when you will do minimal exercise, prolonged loss of smell or taste, depression or anxiety, fever, dizziness when you stand, and worsened symptoms after physical or mental activity. So this is a wide variety of symptoms which can happen in long COVID, and we should know all these. Now, this is a snapshot that when you get COVID infection, you have the viral infection, you have, pneumonia, and or you can have mild disease. But when you recover, almost half of the patients will have some symptoms of post-COVID syndrome. And if you had a severe disease which required hospitalization, then almost 60% will have some symptoms. And these are the common symptoms like fatigue, dyspnea, loss of smell and taste, cough, headache, and vague mental complaints. Not only these symptoms, if person keeps getting imaging like chest X-ray or CT scan of the chest, then 20% will get some findings there too, and that raises a concern. And when people test, their respiratory reserve by spirometry, almost 10% will continue to have some changes. Now, this is irrespective whether you have serious disease, you will still have almost a 60% chance of getting post-COVID symptoms, prolonged COVID, or if you were even, you had non-critical COVID, and then again, 60 to 70% people can have some symptoms leading to long COVID. Now, what are the factors which make a person more prone to this? This was a recent publication only about 15 days back, where there was a combined data from 10 longitudinal studies in UK, which studied what are the factors which can predict a long COVID, and age was the single most important factor. And as you grow older, your propensity to have long COVID increases. And as you can see that, you can have, if you are younger, you only have 8% chance of having long COVID. And if you are older, then at 17% chance that you can have a serious consequence of COVID. Females are more prone to it. And if you are already, before you got COVID, were having poor mental or general health, you're more likely to have, long COVID. People who are obese or people who have asthma are more prone to getting this. Now, there is a concern in most of us when we hear stories about somebody having a sudden death or having heart issues following COVID or prolonged breathing difficulties. There is definite organ damage with serious long COVID consequences, and inflammation of the heart muscle, which is the myocarditis, with moderate to severe COVID-19, it results in heart failure. There could be fluid in the around the heart, or there could be irregular beating of the heart, which can lead to very rarely sudden cardiac arrest. Of course, lung being the primary area of an organ of involvement by COVID, there is always some scarring in patients who have severe COVID, and this leads to stiffer lung. And sometimes, when particularly patients who have been on ventilatory support, this leads to leakage of the air, causing pneumothorax. And the consequences of this pneumothorax being there with the chest tube leads to long COVID symptoms. Now, another thing which we are recognizing is that COVID can also lead to strokes, seizures, or muscle, paralysis due to nerve involvement, Guillain-Barré syndrome. And this can lead to long COVID because of the long time it takes for recovery. And there is now growing evidence that it also increases the risk for Parkinsonism and Alzheimer's. And this is the information from Mayo Clinic. And this is just a diagrammatic representation of, that after you recover from serious COVID, there may be no change in the heart, or there could be some scarring, there could be some fluid or inflammation around the heart, and there can be edema picked up on MRI. If you do MRI of the heart, even 12 weeks after the serious severe COVID, and this can lead to cardiac consequences, and this needs to be looked for and treated adequately. So the COVID infection, when you can get full recovery, which is in about 30 to 40% people. 60% people will have early complications or long-term complications. And Dr. Rahul will be touching upon how to manage these complications. And Dr. Anoop, is going to tell us about what happens in patients who have diabetes and what other complications can happen in patients who suffer from COVID and how to deal with them. And as I told you that we don't know all the answers, there is an ongoing multicentric study, post-hospitalization COVID-19 study. This is a post-hosp COVID study, which possibly will throw more light on what all happens in these patients and how do we deal with it. Thank you very much.
Thank you so much, Dr. Sood, for enlightening us. I can myself think of so many questions to ask after seeing your presentation. But we'll now quickly move on to Dr. Anoop Misra. Sir, if you could share with the audience, your perspective and experience of, post-COVID, especially dealing with metabolic diseases, it would be great, sir. Please, the stage is yours.
Thanks, Vidur, once more, and I'm indeed grateful to Randhir for clarifying a number of issues. Now, what is current situation is something like this. What right in front of you, actually nobody knows anything about post-COVID syndrome. And what CDC and other definitions are, they're all humbug. Let me tell you what my perspective of post-COVID syndrome is. The post-COVID syndrome at this point of time has only two components. Number one, up to 6 weeks, the COVID, either the RT-PCR is positive or acute symptoms may continue. Beyond 6 weeks, if the symptoms continue, it is post-COVID syndrome. And there is another part of this definition, and that is that the symptoms are not explainable by any known abnormality that you see in this patient. So these are, what Randhir has called, we do not know what is the origin of these symptoms, and more research is required. So there is a lot of confusion there in organ-specific symptoms and the symptoms which are arising with no organ damage. So I'll clarify it, but let me first give you a snapshot of the diabetes at this point of time. Just let me have the laser pointer. Yeah, okay. During COVID-19, these are some of our publications. So this is our publication. Broadly classified diabetes is we can classify into two varieties: those who don't have COVID-19 infections and with COVID-19 infections. And number of new diabetic patients have been seen by us, and we have published that data, which are very severe and do not have COVID-19 infection. So a severe type of diabetes without COVID-19 is being seen by us in the last 1.5 years. With COVID-19, there can be mild high sugar or severely high sugar, which could be due to cytokine storm or corticosteroid therapy. And rarely, the virus directly attacks the beta cell to cause severe damage and cause something like type 1 type of diabetes like presentation where the whole pancreas is destroyed. So this is just to let you know that severe kind of diabetes. And on the left side, I'll keep on showing you some yellow boxes which are for people who are non-medical so that they understand fully. So diabetes encountered during COVID-19 era is severe with or without COVID-19 infection. Now this is what Randhir has shown. The long COVID, I do not like this definition. There is nothing like non-COVID. So there is acute COVID with persistent symptom and then post-COVID syndrome. Fatigue is the most common and then followed by malaise and brain fog. If you take these three, most of the people will have these three. But more than 5 symptoms are something which people may have for a longer time. If there are 5 symptoms, people may suffer from these symptoms for a longer time. One more thing as far as the predisposing factor, beside what Randhir has said, is that patients who have been hospitalized and have severe disease have a more post-COVID syndrome. Of course, Randhir has already told you about this, but I would like to draw your attention to tachycardia, persistently high pulse rate. And many of our patients have had high pulse rate for quite some time. So, summary. Symptoms of post-COVID syndrome wax and wane and may continue for 6 to 9 months in some patients. Now, this is our classification. This is entirely our classification. There may be some differences in opinion, but basically, actually, symptoms in post-COVID could be due to organ dysfunction, symptoms related to sequelae of COVID-19, which Randhir has so well described. Then, symptoms related to comorbidity present before COVID-19, whether diabetes or renal, kidney, or something. So it could be same comorbidity could be same before COVID-19, or it may worsen. Or symptoms related to acute complication arising during COVID-19, like diabetic ketosis, a severe type of diabetes, or Randhir was saying of myocardial infarction, stroke, etc. Then there are symptoms related to hospitalization and its consequences, for example, steroid therapy or infection, any secondary infection or mucormycosis, nutritional deficiency, psychological stress. But last category is truly post-COVID syndrome, where symptoms may not be described by one known thing or may overlap with our, but clearly not defined why they should occur, like brain fog, like fatigue, headache, etc. So, summarize. Symptoms of post-COVID syndrome are often multiple in same patient, related to all organ systems, and in some causes unknown. Now, I will focus only on two things because those are important for patients with diabetes. One is the blood vessels, which Randhir had already described, but let me just clarify a couple of points here. This is the blood vessel, given, it's a large, but it's actually very small. And there is a cell here out, which is lining of this is called pericyte, which is damaged in COVID-19. And inside, there are small clots, which are called microthrombi, which impede the blood flow. It could be due to COVID-19 infection, or it could be due to low oxygen saturation secondary to lung damage. But what it causes is low oxygen saturation. That's interesting. And this actually affects every organ system, even if it's not clearly discernible on any test. So it may affect brain, it may affect heart, it may affect kidney or muscle. So this is important. The blood vessel, which is everywhere in the body. So COVID-19 attacks a small blood vessel, damages or blocks them, thus decreasing blood flow to all organs. And patients with diabetes are more affected. I'll show you in a minute. Second organ which I want to describe is muscle. Now, muscle of anybody is determined how much is the muscle function, how big is the muscle. It depends on exercise. It depends on diet here. On the left side, if you see here, physical activity, and if somebody is lying in the bed for 15 days, muscle acutely went down, up to 30% muscle loss is seen. And of course, pre-existing medical conditions, including diabetes and elderly, as Randhir was describing, and direct attack of COVID-19 on muscle. And it could be, there may be some destruction of muscle because of that. So muscle damage will actually cause fatigue and arthralgia, the pain in the joints, in the muscles, and so on. And this may limit the rehabilitation. So, poor nutrition, prolonged hospitalization, drugs, and COVID-19 all cause thinning and weakness of muscle. Patients of diabetes are more affected. This third thing, which is given so low attention and should be high on our card, is nutritional problem. This is nutritional deficiencies post-discharge. Weight loss occurs in 61% patient, undernourishment 15%, low protein, low calcium, anemia, low magnesium, vitamin D, all are low at discharge in this particular study. So, post-fertilization, multiple deficiencies are common and dietary advice is often adequately not given. In fact, last on the card. And patients with diabetes may have more nutrition problems. Now, look at this. This is our study, which is still unpublished. Patients of diabetes with COVID-19 post-COVID-19 and patient of diabetes without COVID having suffered COVID-19, patient of diabetes who have suffered COVID-19 have more fatigue score. While we match these people as far as duration of diabetes, vitamin D, all this can affect the fatigue, we have matched them and still they have more fatigue. So patient of diabetes have more fatigue post-COVID-19. This has not been published, but there's no other publication in the world as far as this is concerned. So if we combine COVID-19 and diabetes both, which organ systems are more affected and lead to prolonged symptoms? Number one, autonomic dysfunction. Nerves are affected, internal nerves. Autonomic means internal nerves, which actually holds pulse, which affect pulse and blood pressure and many other functions. So COVID-19 causes postural tachycardia syndrome. This is well-described syndrome. And diabetes causes also autonomic. A multiple system and persistent fast heart rate occurs in patients with COVID-19, and when combined with diabetes, it may occur more. The sarcopenia or muscle dysfunction, muscle thinning occurs in COVID-19. I've shown you, and occurs in diabetes. So prolonged recovery, marked fatigue, limited mobility. And microvascular dysfunction means small blood vessel dysfunction. I've shown you. So this occurs in COVID-19. This occurs in diabetes, long-standing diabetes, and multiple symptoms, including nerve damage and kidney damage occurred. So in patients with diabetes and COVID-19, several problems due to combined injuries from both can be severe and long-lasting. This is our publication recently published. And this is what has been recently published. So this is my last slide. Diabetes and COVID-19, uncontrolled blood sugar, often uncontrolled, causes severe disease, COVID-19 disease, leading to prolonged hospitalization, assisted respiration, comorbidities, number of other problems, low nutrition, and prolonged recovery, which contributes to post-COVID syndrome, worsening blood sugar, worsening muscle damage, poor nutrition, electrolyte, sodium potassium disorders, worsening of comorbid disease, secondary infection, which Vidur was referring to, mucormycosis and others, psychological stress, marked severe nerve damage, internal nerve damage, and use of corticosteroids, which lead to further problems. So what we need is, this is the last couple of lines, good glycemic and blood pressure control, correction of nutritional deficiencies, psychological counseling, I'm sure Dr. Rahul will talk about it, a study and a slow and escalating physical rehabilitation with physiotherapy and exercise. This should be started as early as possible. Prompt treatment of infection and early stoppage of corticosteroids. So thank you. Thank you, Vidur, for giving me this opportunity.
It's an honor for us to have you with us, sir, please. Next up, Dr. Rahul Gupta will tell us about maybe the most neglected part of the COVID story, which is mental and social well-being and how that plays into the whole post-COVID scenario. Dr. Rahul Gupta, the floor or the screen is yours, sir.
Thank you, Vidur. So, fear has always been the key for drastic measures. The fear of the spread of communist ideology post-World War II, in fact, forced the Allied powers to collectively act and reconstruct Europe and Japan. Similarly, it was the fear of economic collapse which forced India to abolish the license Raj. Presently, for India and the world, it is the fear of descending into an abyss of unending recession following the COVID-19 pandemic. But let us together prove the doomsdayers and the naysayers wrong. Now is the time for global solidarity. Only together we can overcome the intertwined health, social, and economic impacts that this pandemic has created and prevent its escalation into a protracted humanitarian catastrophe. Will life be the same again after the pandemic? This is not a title of a book by Deepak Chopra, but it is actually reality that each one of us has to face. Currently, we are all anticipating a fresh beginning, a post-COVID future where we assume everything will change. Of course, everything has to change. Our lives, our homes, our social etiquette, our manner of social contact, our viewpoint, our societal outlook, everything needs to change. In fact, historically, pandemics have forced humans to break with the past and imagine their world anew. This pandemic is no different. It is a portal, a gateway between one world and the next, but of course at a price. A price of having lost many loved ones, a price of changing our complete outlook to life, and a carry home baggage of emotional and financial stress far beyond our comprehension. Psychiatrists, in fact, prefer to rename this pandemic as a mental health pandemic. The social impact of this crisis has far-reaching ramifications amongst all age groups, caste, creed alike. However, where various meta-analyses or online polls from countries as big as the US or even smaller groups from countries such as Ecuador have shown multiple psychiatric issues which are classical in the long COVID syndrome. These are reduced sleep, anxiety, depression of various percentages in various risk groups and in various age groups, internet pornography addiction, changes in food, changes in eating habits, social empathy. These have been online surveys, studies are still going on, but majority of mental impact has been seen in most patients that have been suffering. So on one hand, we have these meta-analyses to show the negative impact on mental health. Studies have also shown that even amongst high-risk groups, such as health workers, a solid, resilient attitude, a good coping technique, and a strong family backup has yielded a very positive attitude to fight the crisis. We in India are so fortunate with our collective or family living that family support is one of our principal factors which can help us battle any mental illness. At the same time, we have also witnessed a great rise in digital economy, remote working and learning with tremendous ramifications on social and on mental health. Telemedicine, online consultations which have changed the lifestyle and the working style of doctors world over. Online delivery services, consumerism which has gone at a frenzy on the internet and on online services. So here we are battling a global medical and social emergency caused by a virus that we still do not understand. Our focus needs to be a collective attention on the many injustices and weaknesses that already exist in how we live together. Choices made during a crisis can shape the world for decades to come. What measures can we adopt on a day-to-day basis to deal with such a crisis? There are definitely healthy ways to cope with stress. We need to take a break from watching, reading, listening to news stories and social media that keep talking about COVID. It's good to be informed, but constant information can itself be upsetting. So it's best to keep it away. We need to take care of our body. Deep breathing, stretching, meditation, all those which our grandmother told us are good for us are actually good for us. Of course, recovery during post-COVID, we need to go slow on exercise. Enough has been spoken about thrombi and of vasculitis and an endothelialitis, where we have to be aware that there are certain changes that the body needs to adapt after these virus infections. So exercise is something which has to be in a very graded fashion. Majority of us advocate that 3 months post-COVID, do not do any vigorous exercise. You can start with a gentle walk, gradually introduce basic exercises or yoga, and then gradually introduce yourself to going back to your gym routine. What you need is enough sleep. You need to eat healthy. And the most important thing, you need to get vaccinated. Different forms of vaccine are available, but every individual has a social responsibility and a moral responsibility to see that at least all those he is in contact with are immunized. In our workforce, people who are working for us, who may not be listening to what the medics say, but who may be listening to rumor mongers about various side effects and various problems associated with these vaccines, have to be told that those are all rumors. We need to vaccinate, and that is the only way that we can control the spread of this virus. What is very important in this illness is that with social distancing measures in place, we need to connect with those we love. Do not disconnect. Social distancing does not mean that you have to be isolated in your own house, in your own room. There are so many methods of connecting. I remember my wife's aunt who used to live alone and have been busy with our routine or with our medical practice. We found it difficult to visit her, or there may be weeks that we would not go. Till one fine day, she picked up the phone and she rang up and she told us that baat karni hi aadhi mulaqat hoti hai. It is such a relevant term that even talking to an elderly person or talking to a youngster or convincing them that you are around, that assurance is such an important aspect that keeps mental illness completely away. Life certainly has changed for each one of us. And as I said, each age group has been affected. Perhaps the most neglected out of these is children. They have not been to school. They have not been able to go to playground for a year at length. They have been unable to meet friends. They have been glued to their laptops or doing their schooling on laptops, glued to their mobile phones. Naturally, it's going to have a tremendous impact. Can you imagine a youngster who has graduated 2 years from his college in a high school and he has not attended a graduation party because there isn't one? It's all online. We need to encourage our children to rediscover old hobbies, painting, music, reading, things which have gone off into drawers and cupboards, playing board games with our children. Being there for them is the most important thing that can help battle any such crisis. We need to encourage our children to be more active in home chores. We need to make them feel responsible for what we are doing in life. Physical activity is perhaps the most important. When you're not allowing a child to go out into a playground, how do you expect him to be active? Encourage him to do yoga, encourage him to do some physical exercise with you. As the lockdown has improved, as the lockdown has opened out, take him outdoors, take him on a cycle, you have time to spend with your children. Do not neglect that. There are so many issues with children which pediatricians are facing right now, such as weight gain. It's sitting at home, lack of exercise, zero activity, eating junk food. This is going to be a problem which is going to manifest in times to come and must be ebbed or controlled right now. Also, it is very important to refrain from discussing who got sick and how he got sick. It's more important to discuss and encourage talks of who got well and how he recovered. If there are people who we have lost, there are also people who have battled with the illness and have been saved, or they are with us today. So let us discuss those with our children rather than the negative aspect of this pandemic. It's much more important to focus on facts rather than to focus on rumors. With the elderly people, as I said, communication is the most important thing. Keep busy, gardening, painting. There are so many books available to encourage an elderly to do painting, which is a mind relaxation exercise. Encouraging basic physical activity, walking, yoga. Most important is to keep them distracted from negative emotion. For a post-COVID lifestyle, we have to be adjustable enough to strike a balance between optimism and pessimism. Our lifestyle defines our definition of life, and our circumstances define our lifestyle. But circumstances can never be the same. What is important is to know that are we capable enough to live in a post-COVID world? Can we continue to maintain the good habits we have harbored during the pandemic? We follow rules and protocols and principles when the matter is serious. And as circumstances and situations improve, we openly flout the same rules and principles that helped us to survive the tough conditions. Mask, 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 vaccine, vaccine, vaccine. The two only things that can save us from this pandemic need never be forgotten. As the cases decrease, our masks go off, they come up to the chin, they go off the nose. It is not embarrassing to tell your fellow colleague or somebody who's walking down the street to pull up his mask. It is for his responsibility as well as for protection of the 10 people that he may meet down the street. This pandemic is a once-in-a-century crisis. It has to be respected. When 9/11 took place, did we ever imagine that travel in an airport would be so cumbersome that you would have to go to security channels, your wallets would be screened, your shoes would be taken off, your belt would be taken off, but we're doing it all with a smile today. So the same is for the virus. As you have screened for the terrorist attack in 9/11, you have to screen yourself for a virus attack which is imminent. Everybody claims that the third wave may be a milder one, but we have to keep it mild and we have to stop at the third wave. Life has to go on. For those of us who are fortunate survivors, who have kept our jobs, kept our homes, and also perhaps kept our sanity, this has been a year of learning and of realizing what we truly value in our lives. But there is, after all, light at the end of the tunnel. And together, we shall all get through this. And I wish you all luck to get through this. Thank you.
Thank you so much, Dr. Rahul Gupta. That's a beautiful note to end on, because a lot of the questions that we are getting in do carry this, subliminal theme of hope and, will this ever end? So it's, it's amazing that you do believe that it will end. So now we will move to the Q&A part of the webinar. We've got several questions in all from different paradigms related to COVID. One common question that has been asked by a few people is related to hair loss post-COVID. Dr. Randhir Sud, you're nodding aggressively with that. So do you have any experience? Is there any relation between hair loss and COVID-19? And if so, what can patients do to avoid it?
Vidur, hair loss is a common problem with any illness. If you go through an illness which is longish, maybe 2 weeks, 4 weeks, people tend to have hair loss. And when you are given steroids, and when the steroids are stopped, because during steroids you tend to have hair growth, which is unnoticed. And when you stop that, you have a hair fall. But this is not something which is permanent. It is a short duration thing. In fact, there have been work on it which has shown that you don't get bald by with the hair loss after COVID. You will retain your hair. Don't worry about it.
Great, sir. So that's actually very encouraging, encouraging to hear. The next question.
That also does not merit that you start steroids to grow your hair.
Yeah.
No, I think, the whole steroid conversation, we could maybe have a separate webinar on it one of these days, but yeah, we'll refrain from going down that path. One more, targeted question is, and maybe either Dr. Gupta or Dr. Sood, either of you can take this, is around gastrointestinal symptoms post-COVID, right? Diarrhea. You covered it in your talk as well. How severe is it? Is it common? Number one, is it normal? Right? I don't even know how to say this properly. How can a post-COVID disease be normal? But just given the prevalence, is that something to worry about? If somebody is like here, they've asked somebody's child has diarrhea post-COVID, or somebody themselves have COVID, have diarrhea post-COVID. So should they be worried, and what can they do to alleviate that illness?
See, there are two reasons for diarrhea. 1/3 of the patients of COVID get GI manifestation. That is, normally diarrhea is the most predominant symptom during COVID. But the reason for diarrhea persisting beyond 4 weeks is normally twofold. It is either due to the medicines patient has taken, like potpourri of antibiotics and other medication, tonics and all, which do cause diarrhea, so that these need to be stopped. And when there is a drug like azithromycin given that makes people prone to diarrhea, there is something known as dysbiosis. The intestinal bacteria get damaged, and that leads to subsequent antibiotic-associated colitis or prolonged diarrhea. And this can be easily treated by giving probiotics in most of the individuals. There are rare people who tend to continue to have diarrhea. We need to investigate the cause of diarrhea in them. It is not necessarily related to COVID. We know that virus shedding continues in the colon, in stools for as long as, 3 months at times. And there could be direct viral effect on the intestine. We are still not fully, aware of the total effect of virus on the intestines. There is another cause, which is because of the blood vessels getting involved, blood vessels of the intestines getting involved during COVID, which leads to both pain abdomen as well as sometimes diarrhea and constipation alternating because of bacterial overgrowth. And these are the various causes which cause diarrhea. And I think if somebody has diarrhea which is persisting beyond 4 weeks, should see a doctor who is aware of the post-COVID diarrhea.
So that is a very, very relevant point. So to all of our listeners, if you do have diarrhea and if it has been more than 4 weeks, as Dr. Sood puts it, post your COVID turning negative, you should certainly consult a doctor and not take it very lightly and not think that it's long COVID and it will just go away. The next question, Dr. Mishra, if you could take, Dr. Girdhar Gyani, he's one of our gurus, has asked this question, around what are some of the dietary interventions that one can take to address long COVID and, maybe all the features or all the symptoms of it, especially fatigue, etc. So, Dr. Mishra, if you have any thoughts on that, please. Sir, you are on mute. Sorry.
I have shown a slide, how many people have lost weight, how many people are undernourished and are suffering from anemia, and that is another cause of hair loss. You were asking about hair loss, iron deficiency, uh, anemia, calcium deficiency, magnesium deficiency, vitamin D pre-existing deficiency, and then subsequently further existing, and protein deficiency. Uh, all these need to be carefully considered in post-COVID syndrome. And now I have many patients who have lost a considerable amount of weight, and actually, once their steroid is taken off, they are hospitalized patient, also steroid is taken off, then they require lesser anti-diabetic medication because of weight loss itself. But then they further restrict the diet and they say, "Oh, I have diabetes. I'm post-COVID. I don't want to be having high sugar," and they further restrict the diet, and they further go away. So diet part is something which needs to be tackled very sensitively, and most of the time, if patient can afford, we should do a battery of tests to ascertain what are the nutritional deficiencies which are occurring, and specifically looking at least two, three, and that is number one, protein. Albumin levels are particularly important, and iron levels are important. And if the person can afford, because these are some expensive tests, vitamin D and B12 levels are important. Calcium can be given anyway, otherwise. So protein are of paramount importance, and especially in vegetarian patients. And we should ensure that a careful diet is planned for such patients where protein is enough, if kidney is okay, and it has to be jacked up to at least 20 to 25% more than what a pre-COVID level are, in addition to giving enough vitamins and with a gradually increasing exercise. So all these should be combined together, and this needs a specialist intervention, uh, a teamwork. In fact, a post-COVID is a multidisciplinary teamwork. A physician should be involved, a dietitian should be involved, and possibly a physical therapy expert also should be involved.
So just one, repeated point that we've seen in the questions is, so just paraphrasing you, sir, correct me if I'm wrong, but one should not then blindly take multivitamins and protein supplements, etc., off the shelf. One should get a test done first, B12, vitamin D, iron, and albumin, and only then, after seeking a doctor's advice, go ahead and take some of these supplements, right, sir?
Absolutely. Vidur, the thing is that even one takes multivitamin, if somebody is deficient in B12, it will never replete that deficiency. And similarly for vitamin D, because these multivitamins have minuscule portions of each of the vitamins, and they're not going to supplement somebody who is majorly deficient in something, and clearly not going to supplement a protein, albumin deficient. So around 60 to 70% of the Indian patients who are post-discharge would have, or we have seen that, would have albumin level less than 3, and which needs a clear-cut increase in the protein for next 2 to 3 months. That much time will take for recovery of albumin levels.
Got it, sir. Thank you. Thank you so much. Next, I think Dr. Rahul Gupta, if you could take this one, it's almost like a case. I'm not even sure, how appropriate it would be to go deep into this, but this is by Surajit, who's asking, he was hospitalized and was on heavy steroids for a month. And now, even after 3 months, he has speech issues, pain in the throat, hoarseness, and especially when he talks for 15 minutes, he feels choked and has severe pain in the throat. Do you have any advice for him? Is this because of some gastro issue, maybe some reflux or something? What should somebody like Surajit do, sir?
It's more likely to be related to the drugs that he was taking. And I don't know on what basis was he given steroids, what was the CT score initially, because it could be a prolonged effect of the steroids, which has irritated his upper respiratory tract and esophagus. So I would suggest that he should meet a physician nearby and get a consult, to get somebody to at least check his throat that there is no fungal infection there, because that must be ruled out first. And it depends how old is he diabetic? So there are a lot of factors. So if it has been now 3 months since he's been complaining of a choking feeling, he definitely needs to meet his physician and take a call on that. Do not ignore these symptoms.
Got it, sir. Thank you so much. So, Surajit, wherever you are, kindly consult a physician close by, and do not, ignore these symptoms. They are certainly not trivial. I thought that we'll stick to post-COVID, but one aspect of post-COVID life is actually vaccination, and there's a slew of questions here about an opinion on a third dose of the vaccine, mixing up vaccines. Dr. Randhir Sud, I would love to hear your opinion on this. I know it's a fuzzy area right now, and there are people out there who have taken both shots but are not getting the antibody titers one would expect. What is your opinion, sir? Should people just wait and watch, or should they actively try to, it's not allowed, but actively try to maybe tell the government to think about a third dose for such individuals?
You see, Vidur, each vaccine, there's no vaccine which is 100% immunogenic, that everybody who gets vaccine gets antibodies. We know that. There, in the most potent vaccines, there will be some people who will not get antibodies. And I think that if your vaccine is 90% plus efficacious, then it's good enough. We don't need to screen everybody for antibodies. Number two is whether we need everybody's antibodies will show a gradual fall, because antibodies are like your army, which you recruited to the border from your cantonment, and these were there, and then once the fighting is over, there's no new stimulus, the antibodies will fall gradually. But there is something known as immune memory, which remains in the body, which will be which body falls upon. This is the backup. Whenever you get an infection or exposure to the virus, you may form new antibodies and it will go on. We still do not have any answer whether there is any need for a booster dose. We must understand our apprehensions at times are exploited by the pharmaceutical industry, and they would like to sell 3 or 4 or 5 doses. They would like to sell 1 dose every 6 months. But whether that is necessary or not, I think the time will tell. But the basic thing is that if vaccinated people start getting infected with serious consequences after a certain period of time, that would be an indirect indication that we do need, boosting up of the immunity. So I don't think we have a scientific answer to whether we need a booster dose or not. Now, the second question is mixing up of the vaccines. There is definitely some work on which is going on and about mixing different kinds of vaccine. There are adenovector virus vaccines, which is the, our Covishield and Sputnik. They can be, mixed. One dose of, Covishield and one of Sputnik can be given. There are two different, viruses which are vectors in this and can be given. Then there has been some work where now in entire UAE, after the Sinovac, they are getting Pfizer shots because the immunity was less, and there is no, we don't have any contraindication from mixing different kinds of vaccines. But whether that is required or not, it may be just logistical issue that we don't have enough of single vaccines, so we need to mix these vaccines. But I think that is doable, and that may be used if you have not, if say somebody doesn't react to get immunity antibodies because of one vaccine, then even for other diseases like hepatitis B, we give a different vaccine. Similarly, we can use another vaccine here. Say you have got Covishield, you didn't get antibodies, you can get Moderna or Pfizer, and you may get antibodies to that because they're different kind of vaccines.
But the study
I see Dr. Sud's
UAE was
hand
particularly
raised.
interesting because the antibody production of the vaccine they used initially was so poor that is why they have advocated the third dose, not because of a booster shot. So that, as Dr. Sud has mentioned, is a very different scenario totally. It is not related to mixing of vaccines or to a third booster dose.
Just one minute here. There are a couple of studies which show that waning of antibodies after 6 months, because this is 6 months since the vaccines have been given. So to my mind, and I firmly believe that second dose is required. No vaccine at all does well with one shot. And we have whole history here. So I think sooner or later, although there is a controversy, sooner or later, a booster shot will be required. Number two, as far as mixing vaccines is concerned, there are a couple of studies which show that mixing vaccine lead to further side effects. Headache is more, the local pain is more, fever is more, and things like that. There is a published study. But on the other hand, there is another study which shows that mixing vaccine leads to a higher antibody level than the only one vaccine. So yet that issue is also unresolved at this point of time. CDC and President of America both are arguing as far as this is concerned, whether mixing of vaccine or booster shot should be given. At this point, I don't think any conclusion has been drawn.
Great. No, so my personal 15-second opinion on that is that we also have to dissociate the population from the individual, right? At the end of the day, one reason for vaccination is to get population immunity. And when we do tests on individual, we are measuring individual immunity. But if the population itself is strong enough to not spread COVID, then even if some of us may have lesser titers, because there will be lesser viral circulation, the probability that we get infected reduces. So, of course, we can talk about this all day long. Last question, for whoever who wants to take it, this has just come in. I think this is very, very important. Can a person with sulfa allergy take vaccination, or a person with any allergy, right? What are, and maybe Dr. Rahul Gupta, if you'd like to close on this.
The safest is the inactivated virus vaccine. So Covaxin, which is the dead virus strain, is the best and the safest for anybody who has allergies. So what we recommend is somebody who has definite history of strong allergies or drug allergies is safer taking this.
My take would be that we have seen all cases here. Every day there are 150 people getting vaccinated in our center. And I have not seen a single case of any person who has allergy getting a vaccine allergy. On the other hand, we take all precautions. We tell them, please wait for at least 2 hours. If you have an allergic symptom, please let us know. Some people take some anti-allergic medication by themselves, before the vaccination. That is not required. But all precautions need to be taken, although there is almost zero chance of getting any allergic reaction.
No, great. There are so many questions and so many unfinished thoughts, I'm sure, but unfortunately time is limited. We will try to address these questions in due course through social media and other channels. But now, just wrapping up, we'd like to thank our sponsors, IPE Global, MeraDoc, Mahajan Imaging, the Heart Care Foundation, NewsX, all of these groups come together to make this webinar series happen. Especially, MeraDoc is going to be starting a CSR initiative next week, where anyone can call into their helplines and ask any questions related to the post-COVID syndrome or COVID in general. And there would be a physician at the other end of the line to answer their questions. So with that, Dr. Gupta, Dr. Misra, Dr. Sud, thank you so much for taking the time. I know you guys are amongst the busiest people in Delhi. But thank you so much for taking the time to answer all our queries, and looking forward to hearing the feedback. Thank you so much.
Thank you.
Thank you. Okay. Bye.